Hi, I'm Dr. David Hill, and today we're going to talk about recognizing signs of mental illness in children. As we study mental illness in children, we're beginning to realize that the signs are present earlier than we ever thought possible. Children don't have to have adult concerns to experience anxiety. Children can be anxious about a parent leaving, about changes in a family situation, about a new school, a new situation, and they can display signs of mental illness very early. Now, a parent who's observant to their child's behavior is often the first person who notices signs of mental illness. Children may withdraw. They may stop eating well. They may stop sleeping well. Any of these signs, especially if the change is relatively acute and sudden in onset, should prompt a visit to the doctor. The doctor can do a physical exam. He or she can look for other signs of illness in the child and try and determine whether what's going on is psychiatric in nature, physiologic in nature, or even both. For example, thyroid disease may present with depression, anxiety, as well as physiologic symptoms and a physiologic cure. Children may also tell you that they're hearing voices. This is usually in the case of schizophrenia or bipolar disorder, but this can be a very subtle diagnosis because children's reality testing is comparatively weak compared to adults, and they have a very rich fantasy life. So if a child is telling you about an imaginary playmate or something that's fantastical, it can be very difficult to know whether that's a sign of mental illness or just a child's normal imagination. Sometimes it takes a pediatric psychiatrist to really determine whether what a child is telling you is within the normal realm or whether it's something that should be concerning or disturbing. Children will often express mental illness as a physical sign. It could be chronic headaches, chronic abdominal pain, chronic fatigue. These can be especially difficult things to pin down because the physiologic causes of these symptoms are also numerous. It's not unusual that a child with mental illness first undergoes a large series of tests and imaging studies looking for some physiologic cause. However, just because a child has been scheduled for an MRI or a blood test doesn't mean that child shouldn't also visit a psychiatrist and find out if there could be some sort of psychiatric cause of the symptoms. Don't worry, your doctor's not telling you that it's all in your child's head, but your doctor may want to be thorough and get a mental professional, a mental health professional, to help make a diagnosis that could help your child feel better. And ultimately, that could prevent your child from getting unnecessary and invasive tests and procedures and get your child feeling better sooner. So, if you're concerned about your child's behavior, if you think your child is not sleeping or eating properly, doesn't have an appropriate level of energy, seems unusually anxious, or is saying things that seem disturbing to you, absolutely start with your child's primary care provider and see what level of concern seems appropriate and follow it up from there. Talking about diagnosing mental illness in children, I'm Dr. David Hill.